Good afternoon, everyone. My name is Kim Stevenson, and I'm Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Back from Burnout, Connection, Compassion, and Commitment. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2026 annual sponsors and strategic partners for the support in underwriting today's webinar. This is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the one today. I'm pleased to introduce our speakers. Genevieve Chandler is Professor Emeritus at the University of Massachusetts Amherst, and Jim Helling is Director of Changing Minds, Changing Lives Resilience Program. Thank you so much for being here today, and I look forward to the discussion and learning more from Jim and Jenny. Take it away.
Thank you. We're really happy to be here to share with you some information about Changing Minds, Changing Lives, which is a solution that we're offering to transform the experience for healthcare workers from struggle to strength. The COVID pandemic really highlighted just how demanding healthcare work at the front line can be, and how serious it is to find solutions to help make it sustainable for frontline healthcare workers. Ongoing industrial and financial pressures are significant, and generational changes in workforce identity and expectations are adding to the challenges. Next slide, please. So the coal mine of healthcare work, has in it our frontline healthcare workers as the canaries. But as Heather Farley has said, you can't take the canary out of this challenging environment and teach it to be more resilient, stick it back in the same coal mine and expect it to survive. Right? We have to change the coal mine, which means we have to change the environment for healthcare workers, even though it's not really within our capability to make the work less demanding and less challenging. So, what to do? Next slide, please. We'd like to start out by getting a little feedback from you, so you can type into the chat now the workforce needs that you're trying to meet, and what kind of environment would facilitate those changes that you seek. So just take a moment and type something in briefly. So now that you're focused, right, on what you're trying to do and how that effort relates to the environment, next slide, please. We're going to do a brief centering practice, which is a feature that is included in all of the Changing Minds, Changing Life course sections, right? So I'm seeing things like team building, psychological safety, building connections, building relationships. These are key things. But for the moment now, let's turn inward, free your hands, put down anything that you might be doing as you're listening to the webinar. Just bring your attention to your contact that your body is making with the chair that you're seated in, or if you're working at a standing workstation, the contact your feet are making with the floor. And just notice how your body's registering the support that it's receiving as you're arriving here for this presentation. And then turn your attention to locate your breath. One of the movements or sensations goes along with your breathing. And just allow yourself to direct your attention to following your breath just for a few moments here. This movement that happens all by itself, the breath moving into your body and the breath leaving your body when you exhale. And because this movement happens by itself, it allows you just to take a few moments here to let the part of you that directs and guides and leads you through your day to have a short respite as you become a follower. Just following your breath, letting your body settle into the support that it's receiving in whatever posture you're in, and giving yourself a moment from the flow of this busy day to arrive. And as you settle in, just allowing yourself now to consider the strengths that you bring to your work in supporting your workforce. You have your objectives, the changes that you're trying to instill and facilitate. You're focused on individuals and you're focused on their environment as the targets of this change work, but what are the strengths that you bring to that effort? And just sense the presence of those strengths within you, perhaps even locating them in your own body. The sensation of strength that comes to you when you connect with these things that you're good at, that you can rely on and build upon in this work of targeted change in which you're engaged. Just allowing yourself perhaps a slightly deeper in-breath now to signal a readiness to shift, and allowing yourself to come back, reorient toward your screen as we continue with the presentation. With the next slide, and you'll hear a different voice now coming from my colleague, Ginny.
Hi, so I'm so happy to be here with you. We just want to tell you what we know about this, and we've been doing this work for over a decade, so we know that we're pretty confident with the evidence that we've been collecting. But we know that we are working to, as Jim talked about, transforming the environment. And this is what we know about it, relational change process. That's what this is about. The meaning of change happens through relationships and shared understanding, not in isolation. So that's key. And I'm glad it really fits with some of the chat we see that teams are so important. And we take a strength-based approach. That is leveraging individual and collective strengths supports sustainable growth and resilience. What we know is that from from us surveying all the resilience programs and well-being programs in the country, that what's key is that most of them focus on failure. And they focus on failure because they want to find out what went wrong and how we can improve, how we can do things better. Well, that's not our approach. Our approach is based on the research that tells us that it's much more efficient and effective if we start with strengths, what we do well, rather than what we need to improve. So that's totally our approach. And what we find is that connection engagement grows. So people change best when they feel seen, heard, and supported in a safe community. So what that means is that our community is non-judgmental and very inclusive. And we have an impact on the whole team that we're working with, as well as the teams that people go back to in their work environment or in their home environment. Oftentimes that changes as well. So the mindset shifts because of leadership and collaboration and everyday team interactions. Next slide, please. So what we know is that from burnout to bounce back on our own, when people feel burned out, they have depleted energy, diminished resilience, disrupted growth, disconnection, and demoralization. We believe we're in this together, and that when we have that approach, we replenish vitality, we rebuild self-efficacy, we restore positivity, renew relatedness, and rediscover our purpose and our mission. Next slide, please. So this is our approach. We have a very specific curriculum, and the curriculum focuses on self-regulation skills and transformational experiences. So that means in this program, it's very interactive, and so we meet with everybody in an hour, and it's very experiential, and that is people relate their own experiences. So the focus is on people in the room, not so much the sage on stage. We become more a guide on the side. And what we see from this is a very change in growth and real-time group sessions. And it's evidence-based in that I mentioned that we've been collecting data for over a decade. And that data is we do a pre-survey and a post-survey, so we know what the changes are, as well as collect qualitative data. So we collect people's stories that they write every week, as well as their last class presentation when they focus on what they got out of the course. And this has told us over time what works in this course really well and what needs to be adjusted. So it's also theory driven. So we base it on self-determination theory, which is a theory that tells us that the 3 psychological needs we all have. So we need to feel competent, we need to feel agency or autonomy, and we need to feel related or connected. So all those 3 things, competence, connection, and related, and autonomy, is what the environment needs to provide. So we provide that in our sessions, and the people in the session learn how to provide that in their own teams. And that helps really grow people's connections. And then all our other theories we're based on resilience theory. And the resilience theory we use is by Michael Unger. And he talks about how resilience is not just from the inside. That's actually our motivation is a very small part of it. What we really need to notice is that resilience is a relational concept, and that we grow from the inside. What matters is that the success depends on changing the world around you rather than changing ourselves. That's a very different thought. Changing the world around you rather than changing ourselves. Although we as healthcare providers know that very well, because we know health is the interaction between the individual and their environment. And that's exactly what we're doing in our program, is looking at the interaction between the individual and their environment and helping people recognize how important it is to make the environment work for them. Next slide, please. So the building blocks then from our program are the ABCs. So active coping means we look at that we've been resilient before. And, we've been resilient really since we were 2 years old, when we were kind of learning how to walk, fall down, get back up, fall down, get back up. We've already started being resilient. We also believe that resilience is not just something inside of us, which many theories talk about, that, some people have resilience, some people don't. Well, the fact is we all are resilient. And by looking at active coping and making our own decisions about how we manage our own environment is key. The second one is building on our strengths. As I mentioned earlier, that's so important to think about what we do well. And what we do is do a whole strength assessment, and then we create a strength action plan. So every week people are building on their strengths and putting them into action in their environment. It's really helpful. And the last one, cultivating connections, is key. We're not in this by ourselves. We need to have connections in order to access resources. That could be our mom, our mentor, our minister. Those connections are key. That's what resilience is all about. Three things: active coping, building strength, and cultivating connections. Next slide.
So the ABCs of resilience are the way that we operationalize resilience. Active coping, building strengths, and cultivating connections are actions that we can take within our environment. Then the course, the intervention, consists of 10 sessions, each about an hour in length, that consist of 6 learning activities. So learning activities are consistent across all the sections. And these learning activities engage the participants in the actions that operationalize resilience, those ABCs. We start with a check-in based on a positive practice and that strength action report that Ginny alluded to. And we check in with those at the beginning of each class. So there's a textbook, which is a set of 52 positive practices, one for each week. The participants will select one each week and follow the brief exercise outlined in the book, and then share with the group what their experience was in doing that positive practice. Then there'll be a brief centering practice, much like what we did this morning, and then a short review of relevant research focused on the topic of the week. Following the presentation of the relevant research, the writing prompt allows and invites each of the participants to connect what the research tells us about resilience to their own lived experience. So it's a prompted 5-minute free write in which everyone, participants and the facilitators, engage, followed by an opportunity to share the stories. We read the stories to each other just as they're written and receive feedback from the group. The feedback is appreciatively focused. What was strong about the writing, what stayed with you from the story. This is not a time for criticism. In fact, the whole course experience is organized around appreciative as opposed to critical inquiry, which really facilitates the growth of connection and authenticity in shared expression. In the end of each class, there's a reflective ritual where we go around and every participant once again contributes their voice to share an appreciation of something they heard, an affirmation of something they learned during that session, or an appraisal, something they have a question, comment, or just still percolating with. Next slide, please. So here we have the topics for the course. Each week, one of these topics organizes the focus of the centering practice, the focus of the research presentation, and the focus of the writing prompt. These are brief reviews of the research related to this topic that are brought to the participants in a conversational tone that makes it inviting and practically oriented to take a look at what the studies in these areas tell us about growing resilient and thriving under conditions of challenge and adversity. Next slide, please. What we hear from participants is just what you see here. This was a comment made by a participant at the UVMMC, the Vermont Healthcare Center, where we are currently operating a program. And the last class session invites each of the participants to assess and share their learning outcomes. And this person said that it wasn't just something that they learned about, but it was actually they had the experience, they lived it. And that's really key to changing habits. The reason that we meet for 10 sessions rather than just doing a one-off presentation is that we want to activate neuroplasticity. We want to introduce a process of change that can stick, that can last. And we know that the way to change your brain and change your habits is repetition of small actions over a period of time. Next slide, please. This slide and the next couple slides are also excerpts from final presentations of course participants. One of the most empowering experiences that people consistently report is that they experience that they're not the only one feeling the way they're feeling, experiencing what they're experiencing by working in a challenging profession, right? And when they feel less alone and less isolated, people feel more empowered by connecting with others, sharing that experience, to work more effectively as part of the team and feel supported and provide support to others. Next slide. Go ahead, Ginny.
So we find that when we run Changing Lives, it's very restorative, and that's what we're looking for, right? Everybody came into healthcare with a mission, with a purpose, all right? And over time, it just gets worn down because of the challenges of the job, because of the environment, because of all that's expected of us. But we find that when people begin to listen to others in class, they reveal that their intimate and personal thoughts, my feelings of isolation and loneliness lessened, a great weight lifted. I felt true empathy and kinship. The feeling of togetherness is a big takeaway for me. We find that happens all the time. Next slide. So this is what one of the final presentations recently, actually, by a mid-level manager talked about. What I look forward to is changing lives through connection. The power of connection is sustained change is rooted in strong relationships that foster growth, resilience, and performance within teams. That listening and empathy, commitment to listening before fixing, builds empathy and trust, shifting leadership from control to partnership. Also learned supportive environments, strength-based environments, inclusive environments, enhance adaptability and meaningful contributions in changing circumstances. So key. And human-centered change, sustainability, change emerges from honoring vulnerability, fostering connections, and leveraging collective strengths. So we know that, what Brene Brown says is that vulnerability is the seeds of courage. And we cultivate those seeds. We grow that courage. We foster strength through trust and listening. Next slide, please. So another person commented that they found this transformational. I'm leaving this class with a new mindset, assurance that I have what it takes to tackle tough moments, adaptability to reach for new skills that I have learned. So key. And gratitude to see the bigger picture and for the little moments that might go unnoticed. Next slide. So what we find then is the outcomes at 53% of survey items showed statistically significant improvements, an increase in resilience, an increase in emotional self-awareness, an increase of actively coping with stress, and an increase of sense of belonging. So key to those who are feeling so isolated, so alone, and so disconnected. All statistically significantly increased. Next slide, please.
So what we see is that the outcomes of participating in Changing Minds, Changing Lives really are the converse of those markers of burnout that we touched upon earlier. The program reduces stress and increases vitality, fosters a greater sense of connectedness and belonging, stronger self-efficacy, which is the generalized sense of being able to meet challenges, even those that one has not imagined or specifically prepared for, that the sense of competence has generalized. And that's really a very key outcome. More positivity restores the sense of mission and calling. And the course shows effectiveness in meeting basic psychological needs, which is measured by lowering of frustration of those basic needs of competence, autonomy, and relatedness, and raising satisfaction in the same three markers of competence, autonomy, and relatedness. So that's how we can say that CMCL is really changing the experience of working in a challenging environment under challenging conditions from struggle to strength. Next slide, please. transformational leadership, which Ginny has studied,
Mhm.
consists of a number of factors that help to create this facilitative environment, the environment that delivers to frontline healthcare workers a sense of their own competence, a sense of their own agency, a sense of their own relatedness, right? So that their sense of growth and purpose and meaning is restored in doing this very, very important work. As leaders, you are facilitators of the connectivity that is the transformational factor. What our participants tell us is they appreciate learning the skills that are practiced in the learning activities of the course. But even more, they really appreciate the transformational experience that comes from connecting with others, sharing experience, giving each other appreciative and supportive feedback, right? And that change through relationship building is the sustainable pathway to meaningful change. Next slide, please. So now is our opportunity to engage in one other learning activity from the course that we talked about earlier. So the invitation now is to take a pencil and a piece of paper, a pen and a piece of paper, the old-fashioned way, right? And we're going to write longhand, if you're set up to be able to do that, for the next 5 minutes. And we're going to ask you to reflect and write about your strengths as a transformational leader, right? What are the strengths that you bring to this work of creating that facilitative environment, of being a transformational leader that you can build upon in doing this work? So write for 5 minutes about your strengths as a transformational leader. And then we have a kind of a creative way to give each other feedback and share some of those stories. So, Ginny, you want to turn on your timer and
I do.
give
I'm
us the
doing that.
crickets? Give
Okay,
us the crickets when the 5 minutes is over.
we'll do that.
Thank you.
About halfway through, just keep on writing. Try to fill up that page. 1 more minute left. Keep it going. Okay, if we can come to a place where we can stop. There are crickets. We can come back to this at a later time.
So the invitation now, next slide, please. Our feedback for stories that are shared is to focus exclusively on what was strong about the writing, what worked really well for you about the story that you hear or read, and what stays with you from the story, what's memorable, what's something that you're going to take away with you. So the invitation for this format is to now review your own story, read your own story through from beginning to end, just the way you wrote it, without editing it, just taking it as if it's something brand new to you that you're attending to for the first time. And keep an eye and an ear open for what's strong about the writing and what's memorable, what stays with you from the story as you read it through. And whatever stands out for you as particularly strong or particularly memorable, just identify a word or a short phrase that captures that. And then, if you will, type that into the chat. And we're going to collect all of those bits of feedback that are strength focused and appreciative. And Kim's going to create a word cloud for us that's going to show what some of the answers and responses have been to the writing that each of you is experiencing. Okay. So, yes, thank you, Kim. Just enter in your feedback. And while Kim's collecting that and composing the word cloud, Ginny's going to talk a little bit more about transformational leadership. So next slide, please.
So here's what we know that so I learned from my own research that I did a dissertation years ago. My dissertation was on how to create the empowered work environment. So what I learned at the time, so this is, let's say, 16 years ago or so. So at that time, the literature was saying that nurses weren't feeling very empowered. And they weren't feeling empowered because possibly because at the time, the majority of nurses were female, and that females were raised to be kind of compliant and subservient. Of course, that's changed now. But I didn't really buy that anyway back then because the units I was managing at the time, I had some pretty assertive decision makers. And so I was curious as to, I wonder why the literature saying this, and I'm seeing something different on these units. And so I began to study and found someone who did an ethnographic study. So they went in and looked at the whole culture and found that it wasn't necessarily the gender, it wasn't necessarily the person, it was the position they were in. If your position it offers you meaningful information, furnishes you essential resources, provides constructive opportunities, and scaffolds engaged relationships, then you will feel empowered. So it was really the position, not the person. So you can, and imagine that in your own career, you've been in places where you've had that and felt particularly empowered, or you have not had that and felt more powerless. So it really is the information, the resources, the opportunities, and relationships. And so recently I was speaking to someone who was the head of well-being in their organization, and they were saying, we have everything for participants here. We have a well track, I think it was called. And in well track, we have, if there are concerns about things, we have instant kind of mental health consultation. We can refer them. We can have a response immediately. We have an app that offers kind of uh, mindful engagement, so they have something happened at work and they can just tap into it, or they have something that happened at home, they can just tap into it, kind of settle into themselves and have a mindful moment. But she said, you know what? They're not using it that much. We've invested a lot of money in this, but they're not using it that much. What's key here is connection is the brass ring. And Ginny, that's what you're offering, connection through this class and through this, as it's entitled, Changing Minds to Change Lives. And so that I thought was really important feedback to hear, because we're all kind of looking around saying, how can we improve things? How can we get this wellness credential? How can we improve well-being in our organization? And connection is the brass ring. Next slide, please. Next slide.
I think they're putting the word cloud together.
Excellent, excellent. Okay, here we have it. So we're seeing some of these big words here: empowerment, reactive, responsive, kind, baseline of kindness, concise, curiosity, so key, authenticity, descriptive. Okay, next slide, please.
So we're back to our canary. In order to change the environment in that coal mine, we are teaching the canary to be more resilient, yes. But even more importantly than that, we're combining transformational leadership with a facilitative environment. And that really is the formula and the way to change minds and change lives for frontline healthcare workers. Right? The contribution of leadership to create the environment that people can be most resilient, express the resilience that they have most effectively, and thrive, to grow, to develop, to maintain a sense of purpose and meaning, along with a sense of efficacy, belonging, and connectedness. And by providing those experiences, like through experiences like the Changing Minds, Changing Lives course, this is a way for transformational leaders to really support their workforce, to bounce back from burnout, and to transform their sense of struggling in their job to the sense of operating in their job, in their role, from a position of strength. So now, next slide, please. We've got one more opportunity to interact and participate a little bit here. So our closing 3A's ritual. Before we have plenty of time left, so we're going to be able to entertain your questions and have some response to what you want to hear more of. But before we do that, we'd like to hear your affirmations, some statement of something that you may have learned over our last 40 minutes together, a statement of appreciation, something that you are glad and grateful that you heard or experienced in the time that we've shared together, or an appraisal. This can be a question itself, a comment, right? Or just identifying something that you're still puzzling over, considering, but not yet really landed with clarity about yet. So again, please put in the chat an affirmation or an appreciation or an appraisal, just one of the three. And let's see where you're at. And then we'll move into Q&A. I'm not seeing much activity in the chat on my end. Um, so let's perhaps, um, here we go.
Here you go.
There we go. Right. One person uh, appreciated the ethnographic study reference,
Mhm.
observing that it was the structures around us that shape how we show up, right? And a person who's appreciative for colleagues who provide support and guidance for them. Okay.
Do we want to move into Q&A?
Sure.
Sure.
Great.
Sure.
And
Yeah.
if anyone,
Let's
oh,
invite questions. We're happy to answer questions about any aspect of the program or the presentation that people are curious to hear more about.
yes, and thank you. And we've got another comment. Appreciate you sharing your expertise with us. Definitely very calming. I like the breathing exercise and reminders to just kind of just be, just be present, and kind of block out some of the noise that gets into our heads. If anyone has any questions, please feel free to enter those into the chat, and we're happy to go through those. I just love how calming this was for me personally. And I know I've had a chance to talk with folks who have gone through the course, and we were able to bring you and a team from UVM last year to our well-being summit, and just had great feedback, where we got to sit in person and do some of the writing exercises and such. So we have another thank you for sharing your time and expertise. And how do we learn more about the structured program details?
That's a that's a great question. So you can look forward in the near future to getting some more specific information from MHA about an opportunity to participate in a course and experience for yourself. Um, there's also a QR code there, which you can use to access more information about the program. Um, if you have any particular questions about um, the learning activities that compose each session, or about any of the specific topics that we mentioned, feel free to address those to us either now or in an email to follow up. We're happy to respond to that.
So it's an opportunity. I think MHA is offering an opportunity then to experience what we're talking about before. You might think about bringing this to your own organization, um, because I know that in your position, you hear from a lot of folks, how to make everything better. But as we've talked about today, this is evidence-based and theory-driven, and we have had excellent results over time. And so MHA will be sharing more possibility. You can join yourself or delegate someone to come and join this course, and then they can give feedback to you. Yeah.
Yeah, with respect to the centering practice, one person's commented that it was calming and nice sort of thinking retreat during lunch today. That the research says that those brief mindfulness practices do really shift um, our neurobiology so that we're more ready to learn, more open to new information, and also to connect with other people. So it's really quite intentional that we have that experience as a part of every session early in it. So it really invites people to be in the right state to entertain the information and the experience that's being facilitated.
Great. Well, thank you both so much. We really appreciate you being here and sharing this information with our members. I think on the next slide, we have some information about upcoming education events that we have. There we go. So you can scan the QR codes there to hear about some upcoming events. We do have a professional development series and our annual workforce summit is on July 22nd. Registration is open for both of those, along with many other events you can see if you scan those QR codes or go to our website. Thank you so much, Ginny and Jim. Really appreciate it. And thank you all for attending. To all of our attendees. Slides and the recording will be going out to everyone, and we hope to see you again soon. Take care, everyone.
Bye now.